In this segment, we're going to demonstrate a muscle energy technique to treat sacral dysfunctions, and in this case, we're going to treat a sacral dysfunction called a right unilateral sacral flexion. Now, on diagnosis, the patient clinically may have a positive seated flexion test, may have passive reduction of SI joint motion, and on our landmark palpation, we can palpate the sacral sulci, and on the right sacral sulcus will palpate more anterior and deep than the left, and we come down and palpate the inferior lateral sacral angles, and the right ILA will be more posterior and inferior than the left. The lumbosacral spring test would be negative since it would have good spring, but if we put the patient up into the sphinx position, the asymmetry of the sacral sulci should become more symmetrical. So our contact point is going to be on the right ILA with our hypothenar eminence. We're going to reinforce with other hand, and we're going to follow the normal motion of the sacrum during the respiratory cycle. So we're going to find her SI joint first. We want to loose pack the SI joint on the side of dysfunction by taking our hand and abducting her leg, and then internally rotating the thigh to feel where the most offloaded position of the sacroiliac joint is. And we're going to follow down and find the ILA, put our thenar eminence, and reinforce with our other hand. And during inhalation, we're going to engage that ILA from posterior to anterior during inhalation, as well as add a little bit of a cephalad pressure. And then during exhalation, we're going to maintain that, so we resist the sacral flexion during exhalation, and then we're going to exaggerate that sacral extension during inhalation by contacting that ILA with a ventral and cephalad force, and we're just going to follow this motion during the inhalation-exhalation cycle. So during inhalation, we're going to exaggerate sacral extension or counternutation, and we're going to resist sacral flexion during exhalation. We could do this for at least 5 to 7 respiratory cycles. And after the technique, we're going to repalpate the landmarks, the sacral sulci, to determine the symmetry, palpate the inferior lateral sacral angles, and then we could check passive SI joint motion and then reassess the standing and seated flexion test to see if we improve the motion of the sacroiliac joint. So unilateral sacral flexion using respiratory assist muscle energy.